All right, do you know what time it is?
It's time to do our Kegels.
It is, and this is the most, in some ways, my favorite part of the show. Because who doesn't want a strong pelvic floor, Twila?
I think I want one, so I'm good.
Exactly. So this is the time of the show when we do our Kegel exercises. It's so easy. It's so simple and can be so effective and life-changing.
That's right.
And so we are going to go over the customized GynoCast world-renowned regimen.
Okay, you ready?
Yep.
3
times a day.
6
Days a week.
9
seconds per Kegel exercise.
and 12.
Kegels in a row to make a rep. It's so simple. All you have to do is do 12 in a row, 3 times a day, 6 days a week, and hold them for 9 seconds. You will have a pelvic floor like a chain link fence. You will be able to pull a trailer with it. You will be the envy of your neighbors.
I think you will be, that's for sure.
Hello and welcome to the GynoCast. My name is Dr. Eric Heegaard, board-certified obstetrician gynecologist, clinician, not one of those academic types that can't tie their own shoes.
When you say board certified, when you don't say I am a board certified, it sounds like you're bored.
No,
and
I'm
you're
not
a
bored.
doctor.
Okay. Thank you for clarifying. And you're listening to my co-host, my co-pilot, my wing woman.
Twila Dang.
Twila Dang.
Thank you. And
you're listening to the GynoCast. Thank you so much for listening. If you're a repeat listener, thank you. We adore you. Adore you. And if you're a new listener, we adore you in a different way. We adore you bluer.
Can you stop saying that? Just love everybody.
Can you ever see that in our... I better introduce our guests so that we can...
Please do.
But Dr. Terry Johnson for OBGYN West, the best OBGYN group in the world.
Agree.
Yes.
Okay.
In the world. If you want more information on Dr. Terry Johnson, you can go.
We'll have it up on the website, and
That's
we'll
right.
have it in the syllabus.
So there was a book that I used to read to my kids, where this mother, a very kind mother, had 2 children, 2 boys, and she wanted to say that I love you as much. And so they would say, one boy would say, "Do you love me more than Jimmy?" And Jimmy would say, "Do you love me more than Bobby?" And she would say, "I love you the bluest, and I love you the greenest." So
that's cute. I have 3 children, and I just tell them I love you all the same, and the dog is my favorite, so move it along.
So I'm just trying to say that I appreciate our new listeners and our repeat visitors in the same way that a mother breastfeeds her own children, Twila. That's how I feel about them. I feel like I'm
no idea where you're going.
I feel like I'm nursing our listeners at my own breasts.
Okay. No.
Okay. On that note,
That's a bad thought.
Okay.
Yeah. Sometimes he trips over these analogies and just gets lost.
I'm well intentioned.
Yeah, you are.
Can we edit to that? All right.
And what do your breasts look like?
They're not good. All right, today we're jumping right into it because our new goal, Twila has said this. I know you don't want me to. I'm going to say it. Is that we're getting to the topic earlier.
I just want to give the people what they pay for.
We're only 3 minutes in.
Pay for anything, but anyway.
We are less than 3 minutes in.
Yeah,
so we're good.
Amen.
Dr. Johnson is our senior. But it is
and
true.
Oldest
member at OBGYN West, and she has a particular interest and expertise in perimenopause and menopausal medicine as well as everything else. And we are going to be talking about menopause today because I'd like to include myself in it, but if I were a woman, I'd be menopausal.
Yes.
And so I think I better dig myself out of this.
Yeah, I'll help you. I am a woman.
Okay.
I am perimenopausal, but I'm rapidly heading this way, so I have questions. So this is a great show if you have questions, if you're in a process, you're about to enter into a process, or you're not even sure you're entering into the process. Right. This is a great podcast to listen to get a little perspective today.
That's right. And so I think most people think they know what menopause is. And I want to say also that we also have another podcast about perimenopause.
Yes, and we'll link to it.
So if you want to hear more about that, please join us for that. All right, Doctor. We're just jumping into our 4 minutes in it, so we're not wasting time.
Will you stop saying that and just get to talk?
I'm just feeling so pressured. Oh, my God. All right. What is menopause with a big M?
With a big M. So menopause means you've missed a year of periods. And
without another explanation. Well, if you had a hysterectomy and does that make you menopausal?
No.
If you're 25?
No. So it's where your ovaries shut
Kaboom.
down and stop working.
God, I'm in a mood.
Obviously. Let the woman tell you what she wants to tell
Let the
you.
woman speak. Okay, I'm going to step back.
And also when you say menopause, a lot of women think once you missed a month or a year of periods, you're in menopause, but then that's done and you're past it. Mm-hmm. And for us, we think menopause means your ovaries aren't working and you're always in menopause because you're not producing estrogen or progesterone.
Oh, so from a medical perspective, once you're going through menopause, you stay in menopause, like
yeah.
That's...
For us,
Oh.
it's just a continuum where people would think perimenopause, menopause, and now I'm postmenopause. Well, it's the same as being in menopause.
Oh, I would not. That is something I did not know. I actually thought it was like a very specific, like this time frame will happen, these things will happen, and then when it's done, you're not in it anymore. That's a new piece of information. I did not know that.
That's completely wrong.
Oh, is it?
Let's listen to the expert show. I'm sorry, you guys. I don't know. I think
that's okay. I'll just put a definition for mansplaining in here.
Yeah.
Too.
Oh no, I did it. Oh no. All right. So let me ask you this. So, what is happening physiologically when a woman hits menopause? We've talked before about the delicate ballet, the well-oiled machinery of the ovaries. What's happening there?
Well, so the head sends a signal to your ovaries. That's called the follicle stimulating hormone, or FSH level. And it keeps sending a signal, magnifying the signal, screaming at the ovaries, and they just don't respond. So when they don't respond, they're not making estrogen, not making progesterone.
And why do they not respond anymore?
They're old.
They're old.
You've run out
and
of eggs.
They're deaf. You've run out of eggs, basically,
right?
Yeah,
you've run out of eggs. They're old and deaf, yeah. You've run out of eggs.
Well, I know we've talked about this before, but I never fails to kind of interest me the fact that when a baby girl is born, she's got all the eggs she will ever make.
Right.
So as a fetus, a female fetus has already got all the eggs she will ever have in her whole life.
Yeah.
Isn't that crazy?
Yeah.
And so at some point they just kind of run out.
Yeah.
And that's and it's the eggs, it's the follicles or the cysts that
around the
eggs that produce the estrogen.
Yeah.
And so no more eggs, no more estrogen.
Right.
And so what are the basic symptoms that happen with that?
So, and everybody has different symptoms. Some have minimal symptoms. Some have stronger symptoms. Sometimes it can be, a little genetic linked. What did your mom, how was your mom when she went through menopause? Or women in your family, what were their symptoms? So symptoms would be hot flashes, night sweats. And night sweats can be severe enough. You're wet, the bed is wet. You're changing everything one time a night, 2-3 times a night. Mm-hmm. So hot flashes, night sweats, a lot of mood swings, partly because if you're having night sweats, you're not sleeping well. So it's hard to function during the day. Yeah. And some people, they're mild. They don't alter their day. For other women, they're very uncomfortable. They have a hard time functioning.
What percentage of women, because there are some women who just seem to be able to transition through menopause without a whole lot of, at least symptoms that keep them from doing what they want to do. And what percentage of women do you think just kind of cruise through menopause and hardly miss a beat?
I would say not a lot. But then I would say if you look at women that need treatment for menopause, whether it's hormonal or non-hormonal to get through, that's, 80-90% of people are not on any medication. So, but some are uncomfortable, but they just want to deal with it.
Well, yeah, we're women. We do that. I genuinely think a lot of that stuff probably winds up being underreported because knowing us and the way that we operate, we put up with a lot more than we should put up with. We say, we should grin and bear it. We say, when you hear the argument, back in the old days, they didn't have any of this stuff. We'll be fine, So we probably don't even seek intervention for a lot of these things, just because we think somebody else went through it and we can get through it too.
Yeah.
I wonder what they did 100 years ago.
Drank.
They didn't live that long.
Don't you right now?
They probably did.
Well, if you look at if you look at what women did 100 years ago, they stayed home. They maybe walked next door. It wasn't like women nowadays that are out. They're traveling. They've got careers. They're doing things. I think 100 years ago, if you didn't feel good, you were home.
With your fan.
Yeah.
Yeah, but see, you'd still be home 100 years ago. Like they also didn't have modern conveniences, so
Right.
they might be home all day, but they'd be home all day, sort of like doing
Miserable.
everything from scratch and lugging
the-
ice blocks for
Mhm.
the store
With
for the
those
ice chest.
dresses too, those, at least
The
here in the
corsets?
West, the Western world with the,
Yeah, I
the
always have
petticoats
those.
and
I
all
have
that?
those like Laura Ingalls Wilder, like fantasies of like living in the prairie, and then I remember, oh no, girl, that's a lot. Like that would be a lot to have to deal with all the time. So I can't even imagine. I always say when people say, "What if you could live at any point in history? Where would you live?" Right now.
Yeah,
Right.
it's actually when you kind of balance things, it's not bad.
Yeah, it's all right. And I think I said most of this. I think is just more of a matter of sometimes us being too stubborn or too proud to
Yeah.
get something to help us or to engage in something that would help us because we think we need to be stoic or strong or
Right.
handle it or what have you.
So, are you saying that only 10% of women get treated for menopausal symptoms? Something like that? I understand
That's
it?
seek treatment. And I always, my new comment
remarkable.
is, my new comment to women is, it's rare somebody goes through menopause and says, I feel good. There are symptoms, they are uncomfortable.
And so we talked about hot flashes. What are some of the other things?
So-
and mood changes?
So, like, when you're first in menopause, when you're skipping periods, which is perimenopause, but when you've missed a year of periods in menopause, there's hot flashes, night sweats, mood swings. In general, they're typically the worst the first 2 years, and then they subside. So that's current within the first 2 years. Long term, the biggest problem is lack of estrogen vaginally.
Mm-hmm.
Vaginally, things get dry. You feel irritable. You lose the stretch over time. So if you're sexually active, you need a lubricant. Over time, despite a lubricant, you'd say, I'm still uncomfortable. Then we talk about estrogen locally to that area.
So the estrogen has an effect on tissue elasticity.
Right.
So it's not just lubrication or
Right,
that sort of thing.
right.
So we've got hot flashes. Twila, help me out here. Hot flashes.
Hot flashes,
mood
night
changes,
swings, night sweats, mood swings. But
vaginal
it feels like
dryness.
brain fog seems to be associated with this because we all have this no.
Well,
I can't say I still have mama brain when my youngest is 10. That just doesn't make any sense.
Well, in my, with brain fog, that's one of the things that we hear a lot that's happening. And one of the things with brain fog is I feel women do a great job multitasking.
Yeah.
Men can't multitask.
Mm-hmm.
So I think if you look at it that way, it's just you're having trouble multitasking like you used to.
Yes.
So you can't do as many things at once. Men don't notice like the decrease in brain function until they're older because they can't multitask. So women
Don't you
notice
think
it
we're casting
sooner?
a pretty wide net here?
No.
No.
Well,
No.
see, and the frustration comes
Okay.
from you kind of because you hit menopause usually at this,
About age 50.
Yeah, so you hit this point where if you and I it's usually highlighted to me because I now have people in the house who are old enough to point it out constantly,
Yes.
but don't have enough tact not to point it out when they don't need to. I have teenagers. So when you have even a moment of brain fog where you can't place a name or you can't place a
Or-
word in a sentence the way
Right.
you would, they go on and on about it, and then you become more paranoid about it, and then
Yeah.
you become more obsessed with the idea that you're not keeping up with it.
Well, and I tell people, if you go in a room and can't remember what you went in there to get,
Oh,
that's okay.
Amen.
If you go in the room and don't know where you are, then we're going to worry.
Right. Now, I love that you just made a face like, what are you talking about? Like the idea that you would go in a room and not remember why you
Well, I
came
mean,
in there.
that happens to me all the time.
Oh.
I just that's what I'm saying is I'm just thinking to myself,
And that's normal
Maybe I just
aging
want-
brain, too.
yeah,
Right.
maybe I just want to be part of the team here.
Well, you are a sister soldier, so
Oh,
I never
okay,
get mad at you.
Thank you for throwing me a little bone.
Because you do breastfeed your patient.
Right. Now, your
Your followers.
Heavens. Now, if you're talking about, so we know that there's the night sweats. There's then my brain fog that's kicking in.
Hot
There's the
flashes,
hot
night
flashes.
sweats.
Are there any other sort of symptoms that are sort of typical of this that we don't usually notice or that we don't usually talk about?
Well, everybody's a little different, so everyone has a little different symptoms. One of the ones we haven't talked much about that we see a lot is when your hormones are fluctuating or when you've missed the 12 years of, or the 12 months of periods, and we'd say, okay, now you're in menopause. A lot of women notice joint aches. They just feel older. Like if you're sitting in a movie and you're going to...
know that.
You just... Listen.
If you're sitting in a movie and going to get up, you're like, oh my gosh, I can hardly get up. I'm really achy. They saw that. So, okay, I tell people I'm old enough that 20, 30 years ago, women were on hormones for menopause until they died of natural causes.
Right.
Then there was a study that came out about 15 years ago that said, if you're on hormones, you have an increased risk of stroke, heart disease, breast cancer. The media did not quite portray the study, so women did not hear quite the truth about that. But at that time, everyone stopped their hormones. Yeah. Mm-hmm. And the most common thing we talked about, or that I saw, is when women came in, the biggest thing is they were all trying to figure out, do I see rheumatology? Do I go to ortho? I'm having all these joint aches. And lack of estrogen will bring on joint aches and pains for a while.
Does it have to do with estrogen effects on connective tissue or something?
I don't know
like
if anyone's ever really studied it, but it must be because it's very common.
Do people, do those symptoms improve at all with hormonal management? And if you...
the hard part is, when we do hormonal management, we can't bring you back up to the estrogen levels you were before menopause. Mm-hmm. I mean, they're high. We just can't give you enough to get you there. Yeah. And we don't want to. We just want to supplement what your estrogen was just to get rid of symptoms. In some people, it helps. Some it doesn't. Women that have more of different like autoimmune arthritises and that, they find that once they're in menopause, their joints and their discomfort is better on hormones.
We're just not going to tell people how the sausage gets made around here, sir. Okay. It's just how it's going to be.
All right. Now I'm completely
sorry about
kerfluffled.
I apologize.
So I want to go back. So we got the other thing I know that we didn't really talk about so far. We talked about the joint aches, but some women get bladder symptoms that are exacerbated.
Get lack of estrogen over time. Vaginally, things get drier, and estrogen affects the vaginal area and the bladder. So some women feel that they have more urinary frequency, and they're more prone to bladder infections. Also, menopause alters the vaginal pH a little bit. Mm-hmm. So instead of being acidic, which if the vagina is acidic, the vagina has tons of bacteria. Mm-hmm. So when it's acidic, all bacteria is kind of happy, low levels bacteria, yeast. Once you're in menopause and that environment changes to a little more alkaline, sometimes we see more yeast infections, more bacterial infections.
Oh, that's not good.
No.
Yeah. And the other thing, libido. We talked about this when we were talking about perimenopause as well. But many women notice a change in their libido.
Yeah, because the ovaries make testosterone, and the adrenal glands, the little glands on top of the kidney, make testosterone. So it's not like when your ovaries stop working and you're in menopause that you're totally out of testosterone, because your adrenal glands still make it, but it's at a lower level.
Okay, can I segue for just a second, because you just brought up something that I think comes up a lot, and we'll probably talk more about how we treat some of these things later. But I hear a lot, and sort of at my age range, and not from the medical professionals that I speak to, because I go for my regular doctor visits and I go see the practitioners. But when you have access to things like Google. Mm-hmm. And people think they're going to diagnose themselves, I hear a lot of people talking about, they're looking at menopause symptoms and they're trying to find ways to, to help themselves. And they stumble into the category of like adrenal fatigue and things like that. Is that like that weird? Is that one of those like weird sticky wickets where you're looking for one thing, you trip into another thing, and then you start doing stuff that you think will help it, but you really undo yourself somewhere else?
Well,
I'm leaving that to you.
I know, and I was going to leave adrenal fatigue to you because I don't know a lot about it, and my question is it a real entity?
That's
okay. That's my point. That's my point. I think that
we're looking for something to blame how we feel,
right?
And it's right now the adrenal, and as you age, blood flow, your arteries get a little harder. So we'd say, well, blood flow to your heart. Some people have issues with that it's not as good in your brain. All your organs, if you live, 60s, 70s, 80s, blood flow's decreased. So your organs don't function like they did when you're in your 20s or 30s. Mm-hmm. So your adrenal glands aren't going to function like they did in your 20s or 30s. But that doesn't mean you should replace and be on all these supplements to get them back to that age, because you can never do that.
Well, it's also hard because I think that this is an area that's just ripe for opportunists.
Right. Well, see, that's like in my thought process is because when you say 10% of all women really seek treatment,
right.
It's like the other 90% of us are out here trying to make a way on our own,
right.
And
right.
Our stoicism, our stubbornness, our pride, whatever, will lead us. And we will talk to Google before we talk to you as a doctor,
right.
Yeah.
And then we start looking at Google, and you start typing in certain keywords, and all of a sudden it says you've got adrenal fatigue. Stop using toothpaste. Start using this, or whatever it is,
Yeah.
And then all of a sudden you're kind of going down this weird rabbit hole that isn't necessarily backed up and supported, by solid science,
right?
And is also, you're now traveling in weird territory because you're taking things into your body that you might not necessarily want to be messing
Exactly.
with.
I just
right.
think you have to,
and you don't know what's in those products.
No,
right.
A lot of times you absolutely don't.
Yeah, I just think that falls into that category where it's very cloudy, and you have to really buyer beware because
right.
it's just not known.
I always say Google is your friend, but it's not an expert.
Right.
Well, and I just think again that I always look with a lot of compassion in terms of populations or times of people's lives when they're vulnerable. When you're not feeling good, you will do just about anything
right.
and
Mm-hmm.
try just about
right.
anything. And that's a situation that is just so prone to people coming in with an easy answer that's going to cost you a lot of money. And there is a huge placebo effect to anything.
Yeah,
and I could probably give you a pill filled with horse dung and raccoon urine.
Look, you can give me a Tic Tac and tell me that it's going to
Yeah.
brighten my mood on a Tuesday, and
yeah.
I'm like, and that Tic Tac is now I'm
It's better than
sold.
horse dung.
Yeah, and raccoon urine. But that's very true. I bet you if you could you could give somebody a Tic Tac, and if you told them this is going to work, about 30% of people would notice an improvement.
Mm-hmm.
Yeah.
Is that about
Yeah.
what you've heard as well? I mean,
Yeah.
it won't last forever probably, but for a while they'll probably notice an improvement.
Yeah.
And so you said, let me just frame something for you. You said that the worst symptoms are in the first couple years. Is that right?
In most people,
Most
it's the first few years. There are some women that 10 years down the road still have hot flashes, night sweats, and their symptoms haven't subsided. But most women within the first few years of menopause, symptoms are better. And, we don't treat a lot, but that doesn't mean people can't come in to be treated.
Right.
So some people choose, they have awful symptoms, but they're worried about different treatments.
So in the old days, we were kind of, when I was training, you kind of used estrogen for everything.
Everything.
So you would, hot flashes, it was supposed to decrease your risk of colon cancer and bone loss and all that stuff. And some of that is true, but what is the current kind of theory or recommendations in terms of how you manage symptoms?
Well, and it's changing because everyone was on hormones. Then when that study came out, everyone stopped hormones. And now current theory is if symptoms are bad enough, usually I tell people if they alter your day, we would treat you. Now they're redoing all the studies with hormones because now they view there may be a lot of benefit to it,
Yeah.
and should we have more women on it? Interestingly, Sweden the government has now stated that hormones are beneficial, so the majority of women going through menopause, the option of hormone treatment is there.
Mm-hmm.
But then they also view flaxseed as bad. So even governments, countries do things differently.
Yeah.
But right now the U.S. there's huge studies they're redoing to say, well, maybe there's more of a benefit.
Well, you were talking
that.
about that study that was 15 years ago, which was the nurses. What was that?
Yeah.
It was called the Nurses' Health Study or something,
Yeah.
where they looked at thousands of nurses over decades. And when they dug into the information, because it was very complex, it was a huge complex study, they actually found in some people, and help me if I'm remembering this incorrectly, but it was oftentimes the combination of estrogen and progesterone that had higher levels of breast cancer, and sometimes in some women it was the estrogen alone had lower rates of breast cancer.
Right.
It's really murky.
It's real murky, yeah.
And so my understanding is that, like, for example, the biggest complaint that most women have is the hot flashes.
Right.
That really they're saying that we should be treating the symptoms kind of narrowly, meaning that if somebody's got bone loss, you manage the bone loss and whatever works for that. And if it's hot flashes, you cater your treatment for that.
Right.
There's not just one thing that's
right. And years ago, there used to be one way to treat hormonally, and there was no variation in it. So if you were having certain symptoms from treatment, it was like, well, we're done. We're not going to vary that. Yeah. And now it's pretty personalized. There are numerous treatment options, numerous ways to do hormones, non-hormones.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
So why don't we talk about hot flashes, the management of hot flashes? What are the kind of standard options you use with your patients to manage those?
So usually we talk about two different treatments. One is,
actually, before we do that, I'm sorry, I don't mean to interrupt. Can we actually kind of define out for people what a hot flash is? Because a lot of people have them and don't realize that that's what's happening to them. Can we kind of describe what happens with a hot flash so people understand that this is actually occurring to you?
That's a good question.
Yeah, that's what you're having. It's okay.
Well, I'm going to...
You can jump.
Okay. It is a little fuzzy, but, there's hot flashes and night sweats. Actually, so if you think about, you have the umbrella of mammals, and you have camels and duck-billed platypi, right?
Okay.
So,
I have no
and
idea
so
where you're going.
Just hang with me. Just give me a second. Just, and so you have hot flashes, and under that overarching category, you have as a category of hot flash night sweats. Night sweats are hot flashes that happen at night. They tend to last for a short amount of time, a minute, 2 minutes, often with exposed areas of body like your head, your neck, your arms, and you feel flushed, you feel hot, which is why they're called hot flashes. Mm-hmm. But many women will have hot flashes at other times of day. Mm-hmm. And oftentimes it is kind of more of the exposed area of their bodies, and they'll get red, they'll start sweating, they will feel hot.
Okay, because I think that's one of the things, and it took me a while to realize that's what was happening. Even
Are you
to
hot
me.
flashing?
Yeah, I've been hot flashing for a couple of years, but I think the first couple of times it happened, I didn't have any idea what was going on. I was just like, it's hot in here. Y'all need to turn the air conditioning on. I didn't realize it was me. I just thought it was everything else around me impacting me, and I figured everybody else was going through it too. And then I mean, really and truly, I just thought I'm not alone in this. If somebody had to say to turn the AC on, I'll say it. That kind of a thing. Right. And then I probably say a year, and I think I had one good night sweat where I woke up didn't have a nightmare. Why am I soaking wet? Why am I all hot and needing to get out of I'm damp. My pajamas are damp. What's going on? And that was the first time I thought, I need an answer to this question. And I just happened to be lucky that I keep my phone nearby, so I typed it into the phone and brought it up the next time I saw the doctor. And that was it was, okay, let's, now we can start getting you some answers. But I was, I consider myself a fairly astute or, intelligent person. And I don't always know when things are happening to me that's what they are. And sometimes you just kind of need it really spelled out for you. If this happened, it's this thing.
That's actually a good point. And so probably if it happened, I would imagine that once it starts to happen more than once, you start to realize it.
Right. Well, in night sweats at night, a lot of women will either say, I'm waking up because I'm so hot and wet, or they'll say, I'm waking up And I don't know why I woke up, but then within a few seconds, they're like, oh, here we go. That warm feeling, that sweaty feeling.
So now, how would you, kind of getting back to treatment issues, how would you manage those for most people?
Well, and we talk about, do you get a few of them? Usually if hot flashes, night sweats are to the point that it alters someone's day, when they come in and we start talking about it, a lot of women are in tears. They're like, I don't know how I can function with this happening.
Yeah.
So then we talk about there's non-hormonal and hormonal. So if we talk about non-hormonal, for some people we talk about, and we don't use it, some of the blood pressure medications are supposed to help with hot flashes. But if you have a normal blood pressure and we put you on blood pressure medication, you'll get lightheaded and dizzy.
Are you talking, is that clonidine?
Clonidine, yeah.
Okay.
So we don't use that very often. One of the things we use often is Effexor,
An antidepressant.
which is an antidepressant.
Okay.
And we use it. It does help decrease hot flashes. We use it a lot in women who cannot be on hormones. Breast cancer is one of them. Or if somebody comes in with hot flashes, plus they're feeling a little depressed, then I'd say, well, we could try Effexor for both hot flashes and depression. Another medication we use is called gabapentin or Neurontin. It's used for chronic pain. And in the doses for chronic pain, if you don't have chronic pain, you'd be sleeping all the time. So we use it more in low doses at night because women with hot flashes, night sweats, they also don't sleep very well with that happening.
Right.
So we can use that at night to help with sleep, and it does help decrease hot flashes.
Dr. Johnson, is it the sleep issue? Because the hot flashes oftentimes will
Wake you up.
Cause the problem with sleep. And is that when you're talking about whether you decide to, treat somebody based on whether it affects their ability to function during the day? Is it sort of a cascade of hot flashes causing you to not sleep well, so that you don't feel well during the next day?
Yeah, you don't feel well rested.
Oh, okay.
So those are the non-hormonal. So you really have to sit down with somebody to go over what's their comfort level, where do they think the symptoms, what are the worst ones that are bothering them? Or we can talk about hormonal treatment. And hormonal treatment is estrogen, helps with those symptoms. And I would say the majority of, I speak for myself, not for everyone else, but estradiol is what we use. That is more the bioidentical hormone that our bodies make. And we use estrogen. And if you have a uterus, if we give you estrogen, then we could overbuild the lining and cause a precancer or an early cancer. Therefore, everyone who has a uterus on estrogen needs to be on a progesterone to protect the uterus.
And my recollection is that most women, I think my recollection is something on the order of 80 to 90% will notice a significant improvement with estrogen.
Yeah, and we're talking low dose estrogen. And I always tell people when we talk about different treatments, estrogen comes in pill, patch, spray, and cream form. And the reason we don't use much in the way of creams or sprays is they're not covered by insurance. So why do you want to pay out of pocket for it when we have a pill or a patch?
Yeah. Now what? Now I guess into the whole insurance industry business.
Right.
So we don't have the idea that it's all medication and one type of it is covered and one type of it isn't covered.
Right.
But.
And it's not covered. I mean, as you get older in menopause, once you're on Medicare, then it's not covered at all.
See,
Viagra is, though.
Yeah, for men, of
really?
course. Yes.
I don't know. Is it?
Well,
I would imagine it's just because it's
there's so many a month you can get.
60. You can get 60. That's all we're limiting is 65.
And if I could, honestly, as a senior citizen, if my husband can get Viagra under Medicaid and I can't get anything to help me, I'm taking all his pills and flushing them down the toilet every time he gets them.
Well, that's the issue. It's a huge issue.
Yeah. Have you had patients, Dr. Johnson, where I just remember I had a patient of mine, a woman, obviously, and she's like, my husband got this Viagra from his doctor. I want to strangle the doctor.
Right. Because in menopause, as you get older, vaginally things get dry. There's no stretch there. So if the man has Viagra, the woman needs to come in because she needs some estrogen cream so that she's not miserable.
Right.
Before we get, because I want to touch on that next, but I want to finish off with kind of the hot flashes and hormonal management with estrogen and progesterone. Can you talk a little bit about the current idea in terms of the safety profile of how safe is it to take these medications for postmenopausal women?
I think it's a hard question because when we use estrogen, our goal is what is the least amount you need that still helps.
For the shortest amount of time.
For the shortest amount of time. And it's more the safety with a uterus. You need progesterone so we don't harm the uterus or build up the lining of the uterus. I think that's why they're redoing all the studies, because part of the older study 15 years ago was increased risk of stroke and heart attack. Well, what you find is if you go through menopause and you're not on hormones, your arteries will harden a little faster because you'd be equivalent to almost a man.
Yeah.
And over time they harden so cholesterol can stick to them. So if you go through menopause and 5 years or longer down the road, you want to go on hormones, and we're talking oral or patch, so systemic hormones, then we're going to loosen up those arteries a little bit. They're more pliable. Therefore, cholesterol can flake off and cause strokes and heart attacks. So that's why there are times where we'd say, you went through menopause 8 years ago. We don't want to give you systemic hormones, but we can treat, usually the problem is vaginally. We can treat that locally, and that doesn't bump up your blood levels. So I think that's more of the problem with timing. Yeah.
So is there at least what I've been telling my patients, or my recollection is that the studies seem to suggest that a short-term usage of hormones, it was less than 5 years, did not significantly increase the risk of breast cancer.
Right.
Is that still kind of what they're saying? So I guess the take-home message here is that if you're suffering from hot flashes, there are options.
Right.
And don't sit there and suffer if they're bad enough to affect your quality of life.
Yeah.
Now you had started talking about vaginal estrogen. Another big complaint some women have is vaginal dryness and pain with intercourse. Can you talk about some of the options there in terms of treatment for that?
I think first, if we talk about like estrogen in a patch or pill form, it's estradiol, it's bioidentical. Usually progesterone, there are some synthetic, there are some bioidentical. And I think what people have to realize is that with estrogen, the bioidentical estrogen is from plant estrogen. Well, we're not extracting it from the plant and squeezing it out of the plant. There's not enough estrogen. It's all synthesized in the lab.
Yeah.
So it's all made in the lab, and I usually tell people, let's divide it in half. The half that we use is FDA approved, so it's already made up in doses, in a pill and patch form, and we can vary that. Whereas some other people may say, well, we're going to specifically make it up for you, which you end up paying more for, and your body didn't regulate your hormones as closely as some people want to regulate them.
Okay.
So estrogen pill patch form, a lot of times if you and we use that differently depending on if you have migraine headaches and we give you the pill of estrogen, we're going to make them worse. So that's what we talk to people about is which form would you use. Progesterone wise, the more natural bioidentical progesterone helps women sleep better, or it makes them a little sleepy. So we'd have them take that at night. So if they're not sleeping well, that helps also.
Another GynoCast public service announcement is that I think we've all read about bioidentical hormones, and we get this feeling like that's something you have to go to a special place to get, and that it's safer, which, I don't know if that's been, but really we have pharmaceutical grade, as you're saying, Dr. Johnson,
that's safer.
Pharmaceutical grade estradiol, which is bioidentical, progesterone, which is we have the ability to give you prescription for bioidentical hormones. It's not something you have to go searching.
No. So that would be the norm of what we do.
Right.
Yeah. And then estrogen cream for vaginal issues, bladder issues. It's local to the area. We use it in a small enough amount now that it does not bump up your blood levels. And vaginal estrogen comes as a cream, a tablet, and a vaginal ring.
And so this would be the perfect example when we talk about customizing treatment.
Right.
You might have a woman who doesn't really have issues with or hot flashes,
Right.
but she's got vaginal dryness. So we don't
Right.
need to give her a patch or a pill that will
Right.
give her blood levels of estrogen. We can localize the treatment to the vagina.
It almost sounds like, and I'm sure this is going to sound like really rudimentary, but it almost sounds like the way that menopause is treated is almost like a la carte. Like you don't treat
That's
everything.
exactly right.
You do individual symptoms, and then
Right.
so if these two things, you treat for these two things. If it's these three, you treat for these. If it's just one, you treat for the one.
Right. And we do customize it. And sometimes one treatment will take care of 2 or 3 different things.
Okay.
Like, for example, and if you were having hot flashes or hot, flushing, and you went on a patch or a pill, systemic estrogen, that eventually would help with vaginal dryness in a lot of women, right?
Yeah.
So it could be, you'd kill 2 birds with 1 stone.
Yeah.
Okay. I got it. Good to know. Note
Not
to self.
you wouldn't kill 1 bird with 2 stones. Anyway, I'm trying to. So, what other options are there available for vaginal dryness and vaginal symptoms and menopause?
So options, the first option I tell people is the first thing you'll notice over time is vaginal dryness. There's over-the-counter lubricants. KY Jelly, Astroglide are the 2. Mm-hmm. The one thing that we see now is I tell people if you watch TV, you're going to see all these ads for vaginal lubricants.
Yeah.
His and Her, Trojan.
Yep.
The majority of those, I would say, specialized lubricants have menthol in them. And with the menthol, it's supposed to make you tingle.
Right.
And in menopause, your tissue is sensitive. It is going to burn, and in a bad way. So I usually tell people...
Is there a good way?
No, no, that's really important because that's the whole point of those, like, His and Hers lubricants. That's like they even make them so that they react to each other upon contact. Right. So you may use yours, and then it's fine, but then you come into contact with his, and all of a sudden you're in big trouble.
You are smoking.
Yeah,
in a bad way.
But that's super important. That's
so really you really need to look at the lubricants and not. So in menopause, do not use anything with menthol because your tissue will be sensitive and it's going to hurt.
Would you even sort of go as far as to say, like, maybe just stick to lubricant that don't have any additional things, because there are scented, flavored,
so
all
KY,
different kinds of
there's
things.
basic KY, basic Astroglide, and there are some people that will try that and go, it just doesn't work as well. I still feel dry. Then there are silicone lubricants.
Yes.
And I think KY just came out with a silicone lubricant.
They did. And we actually have resources, depending on where you're listening to this, there are a lot of great body positive, sex positive stores that you can go to and get information. There are like websites like Smitten Kitten where you can go to those websites, and they have a lot of really great specialized products. There's even specialized products that I know of that are for people that have particular issues on top of normal health issues, like people that are cancer survivors and things like that. There are specialized products for them as well. So that may even be a category of product that may be more helpful, when you're in menopause than others. But and those are, I always say the same thing: do your research, ask your questions, because there's actually a lot of product out there. You just have to make sure you're reading labels and being really smart. Because you're right, we're kind of in the heyday of these products where there's all different kinds of like novelty to them, and you don't want novelty. You want
something
solid,
that works.
Solid, tried and true, traditional product to use.
Now, how about, I will tell some people to try olive oil.
Oh, coconut oil is the new thing right now.
Yeah,
okay, now
I think it would be messy.
Okay, I have gotten some feedback from people that say they don't enjoy it because what happens is it starts to absorb, like when you're using it on your skin. So if your session is prolonged, you got a problem.
Well, but KY can do the same thing. It gets dry and tacky, and
but it doesn't get tacky. It literally like absorbs into the skin, and then the skin goes back to being dry. Like a lot of people use coconut oil like a lotion, and the whole point of it is that it stays it's oily for a little bit of time, but then it absorbs into the skin. So I remember, because we've been talking about that for a long time, and I've recommended it to people and had people come back and yell at me.
Do you smell like a coconut?
I don't think that's a bad thing, though.
Yeah, it would be kind of like the island sort of,
Yeah.
I don't necessarily think it's bad to smell like a coconut. I think it's bad if you're using it and all of a sudden
it's not working.
Yeah, at the halfway point, it's like, this isn't working anymore.
All right,
you
so
thought it was
you're saying, I'm just,
but it's oily.
Yeah, it is oily. Yeah.
So then you have to put something, a sheet or a towel or something, because it's going to be oily.
Yeah.
All right.
And,
I'm just saying, but for some people,
and especially with coconut oil, because the consistency the warmer it gets, the thinner it kind of gets on you. So I'm not speaking from experience. I don't want to hear any emails. I'm not.
I'm just saying it for some people.
Right.
Yeah, for some people that don't. I mean, there's a lot of people that are way too intimidated to ever go get a product in the store, even though they're offered in like Target now, and I mean your big box retailers and your drugstores. All these, I mean, 15 years ago, these were not like readily available like they are now. Right. But there are still people that they can't even make eye contact with you in the aisle if they're in the aisle with them, let alone buy them. So you do, having an option is always good. If there's an alternate option.
Well, and then there's also a new option. There's a new vaginal cream for women that can't have estrogen, whether it's a cancer, say an allergy, whatever. There's DHEA bioadhesive gel. Mm-hmm. And that's a gel that if you have breast cancer, you can use it. And it's not an estrogen, but it acts like an estrogen on the vaginal tissue.
And they all take a few months to
They do take a few months
right?
to take effect, yeah.
And I know people have also heard about there's some vaginal laser treatments that are kind of they're out there. I don't know what your feelings are.
You have to keep doing them.
Yeah. But are they effective? Do you have any information on, like, I can't remember what the different
I know
brands
they're doing
are,
studies on them now because right now they're used off-label.
Yeah.
Which we do use things off-label, so
Sure.
that's not an issue, but I know they're doing studies now.
And when you say off-label, you mean for a purpose different than the one it was intended for?
Yes.
Exactly. My feeling is, I don't know what your thoughts are, Dr. Johnson, but I kind of feel like I want to watch and wait on that stuff.
Right.
Just give it another year or whatever before we I wouldn't want anybody putting a laser in my vagina, is what I'm saying.
Aces. I agree with you 1,000%.
And I think some people have said it works, but you have to keep going back to do it.
And I don't think it hurts.
No.
It's surprisingly, you'd think that it would be uncomfortable.
I mean, I'll never know. I'm not doing
it.
You say that now, Twila. You shouldn't do that.
I know that's true.
You're limiting yourself.
I'm limiting myself because I'm recording myself saying it, and then I have the contradiction.
I just remember we've been talking about cosmetic surgery and stuff, and
for years I've been like, no.
Now you're,
now all of a sudden I'm like, I'm getting old and gray. What can we do? Let's fix it all. Let's do it all.
Let's do it all.
Yeah, that's true.
Now, and so what do you? In terms of libido, what are your thoughts when you're talking to your patients about libido?
Well, and that's one of the more common things we talk about too, is everyone's libido is decreased, and it is because your ovaries aren't making testosterone. So if we look at a normal range of testosterone, everyone's on the low end. So in menopause, if we're going to treat that, it's a cream that we use, a testosterone cream, a low dose, because higher doses, in men it's patches, sprays, are too strong for women, because then over time we will get facial hair acne. One of the gynecologists that specializes in menopause, one of his lectures talks about using the estrogen spray twice a week, the men's spray. But supposedly insurance does not cover it for women.
Testosterone spray, you mean?
Right. Ooh. So we have a cream, but the cream is not covered by insurance. So you have to pay out of pocket for the testosterone cream.
So I feel like these...
Or the Viagra is.
Yep.
This is amazing to me that there are... That not only do we... Like, there's these class of products that are made for men that women could use, but they don't make them for women in the doses that are appropriate to us. Then we find a way to use them, but they're not covered. I
got a news flash for you, Twila. The people who are making the laws are old white dudes.
Well, that is not a revolution.
I don't know if that's surprising to you, but so that's so that's maybe I'm being flippant about that, but I think there's something to it,
right?
Well, no, you're not being flippant. I think that's accurate, but it is what it is until my kid becomes president, and then that's fine.
There you go. So, and so there are some options. There are some options available in terms of trying. Yeah. But in addition, I know we were talking about this with our other podcast we did about perimenopause. That women's libido is a little bit more complex than men.
Yeah.
Men are linear, and women tend to help me out here, Twila, because I always feel like I'm going to sound like one of those guys who's trying to. It's more circular. It's more nuanced. It's more complex.
It's more nuanced. Yes, I think that's true. I agree.
And so if it's a libido, the cream or the testosterone might be helpful, but you also have to work on some of those other things with your partner.
And we've talked about that, the nuance of the idea that for women it's not just an on or off response. It's how was the day? How did the day go about? Do you have other things weighing on you? The mental aspect plays as much as the physical aspect, whereas men can detach the mental aspect and say,
yeah, the woods are burning.
Yeah, the woods are burning. But
the bombs are falling.
But it only takes 5 minutes. Yeah, baby, it only takes 5 minutes.
That's right. Well, so to kind of encapsulate this, help me out here. But I feel like the take-home messages here are, number one, the symptoms are real. For many women, they are significant and life-changing, whether you talk about hot flashes, night sweats, vaginal dryness,
joint pain,
that you do not have to suffer.
Yes,
right.
And some women are more symptomatic than others, but this is worth a discussion with your provider, because there are safe and effective ways of managing these different things.
Right,
Absolutely.
And it's very individualized.
Right.
Absolutely.
All right.
Okay. If we have any other questions, we'll be able to. You can always email the show.
Or and if you're not a member of the GynoCast Facebook group, please join it. It's life-changing. I know Dr. Johnson, myself, Twila, we were shadows of what we are now.
Indeed.
Simply because of the GynoCast Facebook group.
And listen, it's super easy. You go to Facebook, you type in the GynoCast. You can request to be a member if you aren't already a member. Once you are a part of the group, we review it. We will let you in. And then you get to take part in these discussions. You can pose questions. If you pose a question in the main page, it becomes a part of the open dialogue that everyone has. There's actually a send message option there now, off to the right-hand side, where you can click on that and send a message to us. And it'll be a private message, and we can get that, and we can respond to it, and even respond, hopefully, in a future podcast if you have further questions. And what I can say is Dr. E is always on that page. So if you have a question and it's a real concern for you or something you really want to know about, he will answer that question. He won't wait until the topic is germane to us. He won't wait until another occasion. He will answer it. He's pretty great at sort of following up on his questions.
Kind of compulsive about that.
Yes, but it's a good thing. And I mean, having your expertise and the community of people saying, I've been there too, or I've been through this too as well. It's a really lovely place to be able to have these discussions and get questions answered in a safe space.
Yeah. Join our little family.
Indeed.
All right. Well, thanks for listening. Thank you, Dr. Johnson. Thank you, Twila. Thank you to myself. Because we always have to say, positive self-messaging.
Hey, gratitude is good. It's always right. All right, thank you so much for listening. We'll talk to you soon.